Hello, I'm Andrew Goddard. I'm President of the Royal College of Physicians and I'd like to talk to you today about COVID-19. 3 months ago we didn't really think of this as a problem, but now we're all faced with it in very real terms. I'd like to start by thanking Chris Whitty, our Chief Medical Officer, and Keith Willett, who's in charge of the NHS response, for the hard work that they're doing in getting things ready to tackle this threat. I'd like to focus though on the physicians out there who are thinking about COVID-19, both as professionals but also from a personal perspective. I know that many trainees will be at the forefront of responding on behalf of the NHS, will be put under a lot of stress because of the increased workload, but also because of fears perhaps with things like exams and progression in their career. From the latter aspect of that, I can reassure them that we will do everything we can to ensure that this doesn't impede their progress through their careers at all. From the point of view of supporting each other, it is really important that we all know that this is a tough time and that people will be doing things that perhaps are outside of their comfort zones and working extraordinarily hard in extraordinarily difficult situations. We must support each other. From the point of view of what we can all do individually, we mustn't forget that we can do simple things like washing our hands more frequently, by careful cough etiquette, and taking care of our own health and ensuring that when we are unwell ourselves, we declare that. Those behaviours will be seen by others, and so we should be at our best with regards to that. They're important little things that can make a big difference. From the point of view of the college's responsibility at a time like this, our role is to give you the information that you need as things change. We know that we will continue to provide resources on our website through my bulletin, but also through local members and fellows so people know what's happening. We've sadly taken the decision to postpone our main conference, Medicine 2020, which was due to take place at the end of April in Birmingham. I say sadly because a lot of people have put a lot of work in to getting that conference ready, and a lot of speakers that were coming to it have given up their time already to do so. However, given this is one of the largest medical conferences in the UK, at a time when those staff are needed within the NHS, and also it doesn't seem sensible to have large gatherings of medical personnel in one site, we think that is the wholly right thing to postpone it. We'll be looking at all of our other conferences and big meetings on a case-by-case basis, depending on what's happening in different regions. I would just like to take this last opportunity to thank you for everything that people have already done in preparing for COVID and all that they will do in the next few months. These will be tough times, but I know that we'll get through them. We are used to dealing with pandemics in this country. The NHS is very well set up. We'll all be under a lot of stress, but together, if we support one another and we do everything together, we will get through it. Thank you.